Cutting staff, consolidating divisions, and creating a new organization. The Department of Health and Human Services announcing today 10,000 employees are being let go as the department continues its overhaul of the nation's health agencies. The National News Desk, Jeff Harris joining us. Jeff, HHS Secretary RFK Jr. acknowledged it will be painful as agencies shrink, but promises they will be more efficient. Tell us more about what to expect with this overhaul.
So in addition to those 10,000 employees being cut, Didi, from the FDA, CDC, NIH, and also the Centers for Medicare and Medicaid, HHS also announced that it's consolidating from 28 divisions down to 15, so nearly being cut in half, and creating the Administration for a Healthy America. Jeff Haymond, an economics and business expert, believes there are multiple levels to these cuts. First, the human level, thousands of people losing their jobs.
It's certainly very difficult for the people involved. Let's not miss the human element.
But second, the overall macro perspective, as the U.S. is currently carrying over $36 trillion in national debt.
I'm actually at one level very encouraged that the administration is finally starting to deal with this problem of spending.
Among the cuts, 3,500 are from the FDA, 2,400 the CDC, 1,200 the NIH, and 300 from the Centers for Medicare and Medicaid. Reductions, the HHS says, will save taxpayers $1.8 billion a year. But Jocelyn Johnston, a professor of public policy, believes these moves will only end up hurting individual states.
States that have typically spent less on many public health programs, Mississippi, Alabama, Louisiana.
But more specifically, Medicaid, which millions of Americans enroll in.
1/3 of Americans are touched by Medicaid. They're receiving services through Medicaid.
From a legal perspective, Madeline Somerville, an attorney and political analyst, tells us these employees will have ground to stand on.
If you are a federal employee who's not a political appointee or a political employee, you do have protections.
Especially if there's what's called a reduction in force, because she says there are strict guidelines that govern the process of reducing an agency.
When you decide to get rid of those employees, you have to consider things like tenure or performance ratings or veteran status.
Now, the cuts made today come on top of the 10,000 employees who already voluntarily left multiple health agencies, shrinking the total workforce from about 82,000 full-time employees to right around 62,000. Reporting for the National News Desk, I'm Jeff Harris.